Hello, my name is Hannah Selin, and this is my final exam project for ECCE 2201 Exceptionalities. Throughout this course, I have learned about the teacher's role in working with children with special needs, specifically teaching strategies and the concept that the teacher is there to be the child's guide. I have also learned to identify typical adaptive equipment that may be employed, including assistive technologies. I have learned about assistive technologies and adaptations that teachers can provide to help children with different kinds of disabilities and impairments. This includes low, middle, and high-tech technologies. Another competency area I have learned is how to adapt the learning environment to accommodate children with multiple disabilities. This includes planning methods, accommodations, instructional strategies, the idea of creating a least restrictive environment, as well as inclusion methods. The first way I will use what I have learned in this course is through adaptations in education. This can be done through the learning environment, in curriculum and teaching strategies, and through assistive and instructional technology. As an educator, I will focus on inclusion in my classroom. Children with disabilities should be in the general education classroom whenever possible and whenever it is to their benefit. This is where a key concept known as the least restrictive environment comes in. The least restrictive environment should be one that maximizes the exceptional child's chance of having a successful response to the objectives and goals given to them. Using what I have learned about curriculum and teaching strategies, I plan to approach teaching using the universal design for learning. This teaching approach creates flexibility in educational experiences and instruction. It focuses on multiple means to gain information, multiple means of interaction with information, and multiple means for children to communicate their understanding of information. Another important strategy is co-teaching or team teaching. This is when a general education teacher and a special education teacher share instructional responsibility, accountability, and resources in the classroom. They work together when planning, presenting, and evaluating students' progress and specialized instruction. Finally, I will also use what I have learned about assistive technology. Assistive technology can be low-tech. This would be things like pencil grips. It can also be middle tech, which includes uncomplicated technology like audiobooks, and high-tech assistive technology includes more complicated items like electronic guiding wheelchairs. I will be sure to implement any assistive technology that would help a child gain better mobility and make the classroom more functional and conducive for their learning. Something important I learned about in this course is the concept of teaching to a child's strengths. For this, I have an example of a child with hearing loss, but who may have a strength in visual arts. It would be important for this child's teacher to get to know this child well enough that they learn about their strengths. This can help them communicate in the way most comfortable for them, like through sign language, and plan learning experiences that incorporate their strengths, like visual arts, while also using supportive and constructive strategies to help them with their difficulties. Another key concept I learned about is creating successful school experiences. Instead of punishing children for their aggressive actions or words, I will use a positive approach that focuses on the child's strengths and achievements. My goal will be to help children have a healthy self-image and to know that they are just as worthy as their peers. The first example is emotional behavior disorder, or EBD. Some examples of adaptations include minimizing distractions in the classroom and using picture communication symbols for the daily schedule and transitions. Peer tutoring is another great adaptation for children with EBD. Programs like Peer Assisted Learning Strategies, or PALS, allow children to be paired with a peer who acts like a tutor or coach. The pair meet for 25 minutes at a time to read together, identify words, and so forth. Assistive technologies that can aid children with EBD are computer programs and apps. For example, the app Stop, Breathe, Think teaches children about mindfulness and meditation that helps children check in with their emotions. The Time Timer is a device that displays time passage using a disappearing red-colored disc. This is helpful for visual thinkers and for children struggling with executive functioning. For learning activities, there are board games available that focus on certain topics like social skills, handling anger, or good sportsmanship. Social stories are useful for teaching about social narratives, addressing challenging behavior, following directions, and handling feelings of worry or anger. When planning for children with attention deficit hyperactive disorder, teachers must plan both academic intervention and behavioral therapy. Educators must also understand the child's specific accommodation needs. One adaptation idea is to present information in multiple ways, such as through writing, audio, video, games, or physical activities, paying attention to the children's strengths and interests. Teachers should also set up the classroom in a way that allows for differentiated instruction, or allowing children to work on different tasks and activities at the same time. Assistive technology that can help children with ADHD include computer tutorials, as these give immediate feedback, redirect according to results, give opportunities for self-correcting, and are generally engaging and game-like. Calendars, to-do lists, and schedule reminders are another great way to help children with ADHD in the learning environment. When developing learning activities, teachers should allow for children to convey their understanding of information in multiple ways, such as through a written product, an oral presentation, photo essay, comics, and so forth. Model building is another great option to incorporate into activities, including woodworking, 3D puzzles, and mosaics. There are many ways to adapt the classroom for children with cerebral palsy. Perhaps the simplest yet most impactful is to allow for more time to learn new skills, understand new concepts, and to communicate. Teachers can also give instruction in multiple ways, such as written, visual, and oral. Assistive technologies that aid children with CP include augmented communication devices, such as speech boards. Writing aids like hand splints or slant boards are also helpful when writing and completing other fine motor activities. Team activities require children to work as a group or with a peer. This is great for helping students feel included and valued. For example, the students can act out historical events, stories, and even math word problems. Roles can be assigned according to the student's strengths. Artistic activities are great for developing fine motor skills and hand-eye coordination in children with CP. This can include lacing or weaving, brush painting, or finger painting. One great thing about artistic activities is that they can be done almost anywhere, on the ground, at the table, standing up, sitting down, inside or outside. Here are my references, and thanks for listening.